Hi, Dr. Spurlock here. I want to talk today about the spread of flu because it is really on the rise and it is going to bite our butts. And so the current data from this morning is there's 7.5 million people have been infected in the United States, 81,000 hospitalizations and 3,100 deaths. Now, it typically makes the real old or the real young very sick. So if you're a caregiver of anybody in that age bracket, or you are a part of that age bracket, then really be careful. So speaking of which, how can we protect ourselves? Because it is going around, it is airborne, it is passed by droplets, but it can also be passed by contaminated surfaces. Best protection, hand washing, 20 seconds, sing happy birthday ×2. Mask, just a regular surgical mask, but make sure this just doesn't hang around your neck. Make sure it's actually on, that you are sealing it around the nose and around your face, that both of the ear hooks are on, just like we did in COVID, because COVID is also a droplet. All right. Symptoms you need to look out for: fever, chills, malaise, fatigue, some shortness of breath, headache, stiff neck, body aches. You just don't feel like you want to be bothered. No appetite, none of that. And so the best thing you can do is actually rest. Take antipyretic like acetaminophen to keep that fever down. Lots and lots of fluids if you can tolerate it. Make sure that especially if you live with someone, that there's ventilation in the room. So you want to like crack your windows so that there's some ventilation there, so that you can prevent the spread from person to person within your house. It's still not too late to get a vaccination, but be aware, if you get the flu vaccine at this particular point or any point, then it takes about 2 weeks for you to build up immunity. And so in the meantime, in between time, you still can get sick. And that's some of the reason why I think people say, oh, I feel so sick after I get the flu shot, because you've already been exposed to it. And so then you're getting this vaccine that's going to help you build these antibodies. And so the combination of the two, you don't know if the egg came before the chicken or chicken came before the egg, something like that, but you know what I'm talking about. All right. So again, wash your hands, 20 seconds, happy birthday ×2, wear your mask, try to stay away from people who are ill. If you're sick, stay home. Do not continue to push yourself, because all you're going to do is continue to contaminate everybody else. Students, pay attention to this. If you don't feel well, let your instructors know as soon as possible, so that arrangements can be made for you to get your assignments, or a delay in a quiz or any of that. Don't wait until afterwards. I know you're not going to feel like texting or emailing anybody, but you need to let them know as soon as you know that you're not going to be in class. That is the best and most responsible thing to do. All right, so I hope that helps. I hope everybody stays safe and healthy for the new year, and I'll see you next video. Bye for now.